Hi, everybody. My name is Michael King with King LASIK, and I'm very excited. I'm joined here with my brother, Dr. Joseph King, and today we're going to go through the top 10 questions about LASIK. Dr. King and I have done quite a few webinars, and what we did is we've grabbed all the most popular questions that our prospective patients have been asking us, and we put them together in a nice little video format for you here. So before we begin, Dr. King, you want to say a couple of nice words?
Welcome. We're happy to have you with us, and we hope this is informative and it's helpful to you as you go through your process of deciding if LASIK is right for you.
Excellent. And to jump right into it, so question one is a very common question that we get, which is, what is the recovery time and how much time do I need to take off of work? So maybe what we could do is, let's start from the moment somebody just has the procedure done. What should they expect in the hours and days after laser vision correction?
Well, the recovery time is really fast. It's amazingly quick. The vast majority of people who undergo laser vision correction are able to resume almost all their normal activities within 24 hours. In my case, I was doing eye surgery just a day and a half after undergoing the procedure myself. So it's really quick. You can expect about 3 or 4 hours of stinging, and after one good night's sleep, the eyes should feel pretty close to normal. Perhaps there's a little bit of dry eye sensation, maybe a little bit of glare or halo, which may last for a few weeks. But for the most part, people are seeing great. Nearly everyone is able to drive by the next day, and the recovery is very fast. So you don't really need to take a lot of time off work at all. People have surgery on a Friday are often back at work by Monday. Or if you have it done during the middle of the week, you can probably go back to work within a day or two.
Excellent. Question two is another very common one, which is LASIK safe? So when a patient asks you that question, what's typically your response?
Everybody is concerned about risks. And as a former LASIK patient, I get it. I've gone through the whole process thinking, is this safe? Is it going to jeopardize my career if I had a complication? And I had done more than 10,000 of these procedures by the time I decided, yes, it's safe, I'm going to do this. And now I've done more than 125,000 of these procedures, and I still feel that way. This is a very safe procedure. I have never heard of anyone anywhere in the world, anywhere, ever losing their vision. It will never happen unless there were just an absolutely bizarre event happening. This is so safe. But obviously, there's no medical procedure that's 100% perfect 100% of the time. So it is possible that somebody might need to wear glasses afterward. There are some risks with the procedure. I've mentioned glare and halos at night. It's very rare for it to last longer than a few weeks, but it is possible. Same thing with dry eye. About 1 to 2% of people might need a touch-up. So there is that possibility. But in terms of loss of vision, it's extremely unlikely that anyone would ever have that type of complication.
Excellent. Question three is, what is the difference between LASIK and PRK? So maybe we can just define a little bit of the difference between the two procedures, but then also what would be some reasoning why we would recommend one procedure versus the other?
Well, LASIK and PRK are very similar procedures. The only difference between the two is the presence of a flap in the LASIK procedure. With PRK, there's no flap. The laser treatment is done right on the surface of the cornea after the skin on the surface of the eye is removed. With LASIK, a very thin flap is made. It's typically about 1/10 of a millimeter thick. So it's extremely thin, comprised mostly of skin cells and just a little bit of the tissue that's beneath the skin. So what is the advantage of LASIK? There's only one, and it's faster recovery. And that's why most people who undergo laser vision correction prefer to have LASIK. They're young, they're healthy, they're busy, they've got work, they've got activities, they want to get back to those things much more quickly. But for those who are only candidates for PRK or those who prefer PRK, there are advantages to PRK. With PRK, there's no flap. So as rare as it is, there are occasionally some complications related to flaps. For example, wrinkles in the flap or debris under the flap or a displaced flap. These are very rare things, and it's extremely unlikely it would ever occur. But for some people, they just might feel more comfortable doing PRK. If there's not enough tissue to make a LASIK flap, and there's enough tissue to do the laser treatment, then PRK may be a better choice. And then there are some patients who may be better candidates for PRK based on lifestyle. For example, if they're into martial arts or some activity, whether it's police or military work, where they may be more at risk for taking a blow to the eye, they might prefer to do PRK so that they don't ever have to think about having that flap traumatically displaced. It's very rare, but these complications occur, so some people prefer the more conservative option of PRK. We do both of these procedures. The results are the same.
The next question is, how much does LASIK cost? And I'll tackle this one. So the industry average for laser vision correction in the United States is between, for top technology, around $2,200 to $2,500 per eye. Now, at King LASIK, our prices start at $21.99 per eye. We have zero money down, 0% interest financing for up to 24 months. One quick thing I wanted to mention as you're going through your research process is that if you see any sort of teaser prices of like $299 or $499 per eye, what I would like to say is that that's kind of a pricing just to have somebody to give them a phone call. The reality is that almost no patients get that level of pricing. It's almost every practice that you call, if they're offering, top tier technology, will it be around that pricing? But again, we have some phenomenal financing packages to make it affordable for you. And we go through all the pricing at your initial consultation, which is free. We'll be able to outline what the right package is and for you at that moment. Next question is, are there any side effects from LASIK? So Dr. King, what are your thoughts on that question?
Well, side effects are rare, but every procedure does have some potential side effects. The most common side effects that one might see is some dry eye, sensation of dry eye in the immediate post-op period. And the same thing applies to the sensation of seeing glare at night or halos around headlights. And these are not unusual symptoms in the first few weeks. That it almost always subsides, but it is possible, and it's very rare for it to last longer than a few weeks. If it does last longer than that, typically we do have remedies for it, and there's a reason that we can address. Other potential risks, which we've talked about, is the potential risk of a touch-up. So although we can't guarantee that every patient will be free of glasses, it's well over 99% of patients who are glasses free. And beyond age 40, people do need to wear glasses for reading if both eyes are corrected for distance. So we do have the option for those patients who are over age 40 or 45 of slightly undercorrecting the non-dominant eye to give a little bit of help at near. So that's something we can talk about at the consultation. And we'll go through all of the potential side effects and risks with you during your consultation at our office.
For those of us who are past the age of 40, the question that we commonly get is, how will LASIK correct my reading vision? So how do we respond to that one?
This is a great question. Nearly everyone who sees perfectly at distance, beyond age 40 or 45, certainly over age 50, will begin to notice that their near vision is becoming more challenging. And that's because the lens in the eye doesn't change shape as easily over age 40. And as a result, most people find that if they're wearing glasses, they'll be wearing bifocals. Or if they wear contacts for distance vision, they'll wear reading glasses over their contacts. And if someone's had laser vision correction to provide them with excellent distance vision, then they may need glasses for reading. So one technique that's been used is to correct one eye for distance and leave one eye slightly nearsighted to help for the reading. And that's a possibility. We can certainly demonstrate that to you if you're interested in it. If you're younger than 40, our advice is typically correct both eyes for distance. And if you're over 50, you might consider the monovision, but it really depends what you want. If you want the clearest distance vision, for example, sports, driving, whatever your sports activities are, golf or tennis, you really want the best depth perception. That comes with both eyes corrected for distance. But if we do correct both eyes for distance, then typically glasses will be needed for reading.
Excellent. And our next question is one that it's a bit of a misconception that patients have is like, can LASIK treat astigmatism? So what's our short answer to that one?
The short answer is yes, it corrects astigmatism. We can treat up to 6 diopters of astigmatism. It's a common misconception that LASIK can't treat astigmatism. And I think this goes back to the initial approval of the lasers more than 15 years ago when they were approved for treating nearsightedness, but not astigmatism. And for more than a decade now, we've been able to treat significant amounts of astigmatism. And nearly every patient we treat has astigmatism. So if you've got it, we'll treat it.
Excellent. And another question we have is, does LASIK hurt? What's your thoughts on that one?
Gosh, everybody's concerned about this one, including me, and I've had LASIK. I can tell you from a patient perspective, no, it doesn't hurt. It feels like pressure on your eye. We use numbing drops. The numbing drops numb the surface of the eye. LASIK involves a treatment to the outermost 1/10 of a millimeter of your eye. So it's extremely superficial. And so the numbing drops, which numb the surface of the eye, take care of really any discomfort. Afterwards, it does sting for about 3 or 4 hours. And if you pre-medicate with some ibuprofen, you'll be a little bit more comfortable. But by the next day, most people feel great. But the procedure itself is generally comfortable. I think the only time it really hurts is if somebody's really anxious and they come in and they're squeezing their eyes closed and they're resisting against this instrument we use to hold your eyelids open. That's when they might feel it. But for the most part, it's a pretty comfortable procedure and it's very easy. So just relax. You'll be okay. And we've got lots of numbing drops. We're very generous with those.
Excellent. Our final question in our top 10 questions about LASIK is, how do I know if I'm a candidate? What's the next step for somebody after they've watched this video and they've had the opportunity to kind of get a lot of their questions answered? What's the next step for them?
Well, the next step is to come in for a free consultation. And we do offer these on a complimentary basis at any of our locations. So you can come into either Lynnwood, Redmond, Renton, Tacoma, our Vancouver, Washington office, or Tigard, Oregon, or Kennewick, and you will have a complimentary consultation. We'll do a complete eye exam, evaluating the health of your eye, the cornea, the lens, the retina, and evaluating whether you are a suitable candidate for laser vision correction. We do some detailed mapping of your eye. We measure the prescription in a number of different ways. And at the end of that visit, you will know whether you are a good candidate for laser vision correction. So you really need a full eye exam. And we're happy to see you and to provide all of the information that we have to help you go through this process. Some patients aren't candidates. So if you're not a candidate, we'll let you know what is the best option for you for your vision correction, whether it might be cataract surgery or whether you need treatment for another condition, or whether you're best staying in glasses or contacts. We do a number of different procedures. If you do want to be out of glasses, there is a remedy for you. We offer not only LASIK and PRK, but implantable contact lenses and lens exchange surgery, cataract surgery as well. The majority of what we do is laser vision correction, but it really all starts with that pre-op exam where we will listen to you, what you're hoping to obtain, and complete examine your eyes, and we'll be happy to meet with you and to help you go through this process, determining what your best path is.
Excellent.
So we look forward to meeting you. Thank you.
Yeah, and on that note, again, this is your journey. These are your eyes, and we understand that this is a big decision, and we really truly hope that you found a lot of value here in the top 10 questions about LASIK. Again, if you would like to schedule your consultation, you can go to kinglasik.com. You can schedule online, or you can give us a phone call. Thank you so much on behalf of Dr. King, myself, and all the King LASIK team. We look forward to seeing you when you come into our practice. So
we're looking forward to seeing you. Thank you so much for taking the time to meet with us. See you soon. Bye-bye.
Thanks, everybody. Bye-bye.